Hello, I'm Philippa Oakley. I'm the chiropractor here at Acorn Health, and I wanted to answer a question today, which is one of the ones that we get asked most often in clinic, which is, when my back hurts, is it safe for me to exercise? In order to really answer this question properly, I have to talk a little bit about pain and how and why we experience pain. And one of my favourite ways to explain this is to talk about pain as a fire alarm. So fire alarms operate by sensing smoke or heat. And when they sense smoke or heat, they'll sound at the same volume, regardless of whether your house is burning down or you've burnt some toast. And we know that pain is very, very similar. So regardless of what's driving the pain response, that fire alarm, that pain response is going to go off and you're going to experience pain. And some really good examples of this are to look at people like soldiers in battle. They can suffer really traumatic injuries and report having no pain at the time. And other people experiencing, if you've ever had a paper cut, for example, it's a tiny, tiny injury, but it can produce a huge amount of pain. And the reason for that is because pain is 100% of the time generated by our brain. And that's not saying it's all in your head, it's just that's where those processes take place. And your brain will process a lot of information and decide if it's helpful for you to experience pain. If it is, you'll be in pain. If it's not, you won't. And the level of pain that we experience relates really poorly to the severity of the injury. And sometimes we can actually get pain when there's been no injury whatsoever. You look at migraines, they come out of nowhere and they can be completely disabling, but there's no injury that's brought them on. So we know that pain is really unreliable to indicate whether there's a severe injury underneath. And that's one of the things that can make it so interesting to treat and to work with people on. So when it comes to exercise, we have to talk about things in our brain that are called our ignition nodes. And those are little nodes in our brain, little nodules, clusters, which are used for movement, emotions, memory, and sensations. And over a period of time, when somebody has chronic pain, those nodes can become oversensitive and excited, basically, and it doesn't take very much to set them off. And so the brain gets very, very good, very, very fast at processing the signals that it receives and in turn producing pain. So it's like learning a musical instrument. The more we do it, the better we get at it. And so with persistent pain, we really have to work to try and break that cycle. And one of the best ways to do that is through exercise, because exercise is really, really good at reinforcing this idea that you can be sore but safe. So with our patients, we like to give exercises and we like to encourage you to be active. And yes, absolutely, even if you've got back pain, we like to start you off doing some exercises because it's best to gently nudge at the pain. We don't want you to avoid movement completely, but we also don't want you to be forcing yourself through real agonizing pain. So I tend to say around a 4 out of 10 is okay. And the reason for that is because you're reinforcing the idea that movement is safe. And we can tailor exercises and put you in different positions so that there are less things going on that your brain is worried about and it feels more comfortable doing. But definitely exercising with back pain, we know in the research and the evidence base, when you look at how we treat back pain, exercise is one of the very best things that we can do. So some of the other things that you can do with back pain are to talk to people who understand the biology of pain. So unfortunately, that's often not our friends and family, but we have to work with you as practitioners to help you understand why you've got pain, because it can be really disruptive, really disabling, really upsetting, and there can be lots of worrying thoughts and feelings that go along with that, and we can help you understand what's going on, why this is happening. And we know that the more that you understand pain and why you're experiencing what you are, the better you're able to control and cope with it. So that's something that could be really helpful alongside exercise and hands-on treatment if it's required. But exercise is very definitely something that we should all be looking to do when we've got back pain. And we need to move in order to get our backs better. So that's definitely something that we would encourage you to do, but start off gently. So we don't want you going back in and really forcing yourself through pain. We don't want you overdoing it in the gym. And that's why a structured supervised exercise program can be really, really helpful. So as a general rule, we would always say if you've got back pain, make sure we know what's going on and what's happening. But as a general rule, absolutely, exercise is really, really safe and a good thing to do when you have back pain.